first provider that's seeing this in some cases. Which kind?
So then, I guess, what would you wish that your doctors that you went to would have done differently in the process of getting you diagnosed? And what would you, like, if there were something you could give us to take away from it?
I wish that and I have thought about this a lot because, you have to be realistic and you can't, you can't hold a grudge against the world forever. And I think that having my son and raising my son, he started having problems sweating years ago when he was in baseball. And the first time he went out, he stopped sweating and kind of turned red at the end of at practice, but he kept an eye on it. Next day, it was halfway through practice, and then he came over to the sideline. And the next day, it was, man, you don't look so high. Let's not go to practice today.
He almost passed out, was what happened. He got really pale and had a hard time walking over because he kept getting heat exhaustion repeatedly.
I wouldn't have been parented like that. So, what can you guys do? Well, you can do everything that you can, and you can still fail. And you guys know. I think that educating the parents, and maybe they're not going to be able to understand all of the ins and outs of what to look for, and you can't expect that you're going to reach everybody, but if you can just go like, hey, you've got a delicate one here, very special, very smart, you have to treat them gently, will grow into very, very bright stars, delicate flowers.
I think you can train your hands too. Because when you passive range somebody, you can feel normal tissue tension. You can feel neurological tissue tension. Have they had a stroke? Have they had cerebral palsy? You can feel different things.
Yeah.
Ehlers-Danlos feels freaking weird. So when you range somebody, if they've been a gymnast their whole life, they're going to have excessive back extension. In a healthy individual without a connective tissue disorder, that feels different than somebody with a connective tissue disorder who does gymnastics. And for some reason, it's like they do. These kids, because their genetic type fits, they excel in gymnastics, they excel in swimming. And then they're doing these cardio workouts that are giving them what they need, and then they hit a growth spurt in their teenage years. And I've seen a 15-year-old who was pre-Olympic trial swimming, he's now in a wheelchair. And between Ehlers-Danlos, POTS, and CRPS, in his mid-20s is barely functional. So I think you learn to trust what you feel, and you gain that by touching everybody. Patient comes in and they're complaining about something, you range the joint and you kind of get a sense of, okay, this is a normal wrist, this is a normal wrist, this isn't normal.
Do you think that my skin texture is noticeable?
Yeah. Like EDS patients, they don't look like they age. They're young. They have a different elasticity and wrinkle. So
you guys would like to feel my skin.
Yeah.
Like, is it like the velvety?
It's not totally different, but it is. Even just his skin is a little different. Yeah.
Yeah.
So you learn to trust your hands as part of it.
Can mess around with your